Good afternoon. I am Dr. Arvind Poswal from New Delhi, India. One thing which people ask me during these coronavirus times or corona epidemic times, what is one important thing which you think which must be done? In my opinion, the one most important thing is preserving knowledge, preserving wisdom. So today I will be talking about the importance of preservation of knowledge and why I think the holding of GHLS, the Global Hair Loss Summit, is a very good initiative in this respect. Let's start why it is a good thing by itself. Earlier, there were conferences and doctors used to go, some, to many different places around the world to get some information. Now with the organization of GHLS, it is as if all the information from all around the world is collected in one place, where doctors, even those who cannot afford to travel abroad or to different destinations, or they do not have the time, they can go through them at luxury. This is not what was there in pre-COVID times. Now, unlike many other medical fields, hair transplant is still in its early phase. It's still nascent and an unorganized field in medical. There are some books which have been written, but respectfully, all of those books usually present the view of a particular author or a group of authors, whereas there are many doctors around the world who have been practicing this field and all have their own pearls of wisdom, all have encountered some difficult problems during their hair transplant procedure. They overcame it in a different way but reached a really nice result. So that compilation of knowledge and, if possible, training of more and more young doctors in the correct way of doing hair transplants is very important. So one is preservation of knowledge and the other is actual real-time training for doctors. Now, there are many veteran hair transplant doctors in different parts of the world. Now there may be some in the Orient, China, Japan, Taiwan. Now they encounter a different type of hair, whereas those in the Scandinavian countries may be encountering a different one. In India, for example, we have all different types of hair. The thick caliber hair from the Orientals or the really curly hair you find in people from African origin, or really fine hair, like fine caliber, like you will find in Kashmir, right? So all are different type of. If a doctor or an author has exposure to only a particular type of hair, now he will be able to give the best knowledge about that particular type of hair, which may not be suitable for another doctor who is yet a student, but who is practicing on a completely different type of hair. So, like for thick caliber hair, like the oriental hair of people of Eastern origin, now it's very easy to use the plunger in that. But it's not the same in the case of very fine hair in the, let's say, the blonde Scandinavian nations. So there are many pearls of wisdom and nuggets that different doctors have with them. They can't all share it in a single textbook, but they can share it in today's world through this video method and online conferences. Now, for example, in my case, I learnt a very interesting thing. The lecture which was given or the presentation which was given was by a doctor who was formerly a neurosurgeon. And when I witnessed his lecture, I came to know about what precaution a hair transplant doctor must keep in addition to those about antisepsis. Now this, he mentioned about a case of PV shunt. Now, a PV shunt, for those who may not remember or those who may not know about it, is a shunt, a tube which is put from the ventricle of the CS so that excess CSF can flow out and reach the abdominal cavity. That procedure is usually carried out in the infancy of the child, or at least before they reach a reasonable age. So by the time the patient comes to us, maybe in their 20s or 30s, this tube for them may not be a very big issue, but for a hair transplant doctor, it can be a real lifetime emergency. Imagine a tube transferring excess cerebrospinal fluid from here and going all the way to abdomen. And if it were cut inadvertently, that would be a medical emergency. So similarly, when I witnessed this lecture, it stayed with me for life. I actually had 3 cases of PV shunt after this and really thanked that author. Similarly, many different nuggets or maybe tricks of trade, like how to counter excessive bleeding or how to control pain in a patient who is extra sensitive to pain. What to do when one encounters a really curly hair like the African hair. All of this and much more knowledge lies strewn across the globe. It's not that one person or one particular textbook or one particular doctor, a veteran doctor, can teach everything to the next generation. It's all of us. And I'm happy that an event like GHLS has been organized, because in the previous conferences, it was not made public. The lectures were not made public. They were not freely accessible. Now here at least it will be accessible to the doctors, and I hope that it remains freely accessible. These lectures remain freely accessible to generations now and in future. And it should become a way of life. That is the true way of sharing knowledge. The person who watches this may not be a friend of mine, but to preserve this knowledge, it is important to compile it in one place so that everyone can view it without any charges. Now, for the young doctors, I can just say that see as many of the lectures, see as many of the presentations, because you will hear different viewpoints from different veteran doctors. All of them may be correct. Maybe different views may be correct on different patients. It will be a really good experience. And today I welcome, as I have done before, that yes, any young doctors or even other doctors who want to learn, they can come, they can learn in a comprehensive manner. Please do not think that my 5-minute, 10-minute talk, or you watching a lecture, or attending a workshop, or planting 10 grafts will make you an expert. It will not. I will not get myself operated upon by a doctor who has attended maybe 10 workshops, 10 conferences, but who has not himself performed at least 50 surgeries. I'll prefer 500, but at least that many surgeries, and I should have seen his results. So if a training is available, it is my humble request, wherever you are, try to avail of as much of this training as possible. I would say, like they say in aircraft flying sequences training, that have at least 1000 hours of training under your belt. Yes, 1000 hours. It's a long time. But you will find that there is a lot of things which the teacher cannot teach, because I myself would never know what to teach, because every patient will not present all the challenges. Right? Let me know if you have any questions, and I will be presenting in GHLS. For example, my aim is to present about beard area extraction. We have been extracting grafts from beard, from body, and the important challenge was to extract grafts from the beard without visible scarring. Now that is where we know we are good at. Similarly, there may be another doctor on other end of the world. He may be good at something else. So make all best use of it. Attend GHLS or at least talk to doctors, veteran doctors. Now is the time during this epidemic. Compile your questions. Make a list of 50 questions, 60 questions. Contact doctors, contact veteran doctors, send them your list. Maybe some of them may not answer you. But at this time, I think, in all honesty, most of the doctors will share their knowledge if they are able to. I am there. If you have any questions, and if you have been in this field or you want to enter this field but you want to be perfectly trained before that, do not hesitate to send me an email or a phone call or a WhatsApp. My website is fusehair.com. Thank you.